If you're a rural health provider in Minnesota, there is funding right now that will pay for mobile health, but you have to act quick. In this video, I'll break down how it works and what type of programs you can run with it. The Rural Health Transformation Program is a federal and state initiative. It is run by the Minnesota Department of Health. The goal is to expand access to care in rural Minnesota without building new facilities. What sets it apart from most grants is it's not competitive. Rural hospitals, FQHCs, tribal nations, CCBHCs, and CMHCs are all eligible, and funding is formula-based. There's no match requirements, and applications are rolling until May 15th. The program has 5 initiatives. The one that we're going to focus on for mobile health programs is Initiative 3, Sustained Access to Services to Keep Care Closer to Home. Behavioral health care access in rural Minnesota has gotten worse over the last few years. There is fewer providers and longer travel distances. RHTP aims to address that by funding community-based delivery. Here's the thing, people that need behavioral health support the most are often the last ones to walk into a clinic. Stigma is real, and so is distrust. A mobile program that shows up in places that are familiar changes who gets help. Screenings, crisis follow-up, peer support, telemental health visits, and substance use outreach, all where people actually are. The vehicle itself matters as well. A counseling space that feels clinical won't work. Soft seating, soundproofing, dimmable lighting. It needs to feel like somewhere a person would actually sit down to talk. Most people don't think about telehealth as something that has to happen inside a clinic. Unfortunately, traditionally, this is the case. You go to a clinic and meet with a provider that is somewhere else. RHTP aims to change that. The program funds community telehealth access points. Minnesota Medicaid already pays for live video visits and remote patient monitoring. The billing infrastructure is there. What's missing for most rural providers is a way to show up and connect. A vehicle with satellite internet solves all of that. Park at a community center, a school, a workplace, or anywhere at all. And within minutes, you'll have a private, connected space where someone can see a specialist instead of driving 2 hours for a visit. Chronic disease management, mental health consults, MOUD pathways for substance abuse, all of it becomes reachable in places that never had that option. Mobile, preventative, and primary care is where Minnesota's language is most direct. Under Initiative 3, rural hospitals, FQHCs, and tribal nations can use RHTP funding to plan, purchase, and outfit mobile units for physical and oral health services. Minnesota has some specific services that they want provided from mobile units. Screenings, primary and preventative care, lab work, basic dental care, referrals, and telehealth connections to specialists. One thing worth noting in the financial side, RHTP covers the vehicle and the infrastructure. Clinical services on the units are billed through your normal reimbursement channels. The grant funds the setup, your existing billing sustains the operation. Tribal nations are named throughout RHTP as a primary target. Award ceilings go up to approximate $808,000, depending on the nation. And tribal nations can apply directly for mobile unit funding. The barriers that make mobile care valuable for rural populations generally go deeper in tribal communities. Distance, distrust, lack of transportation. These are layered with historical context. A mobile program that comes to the community in a culturally grounded setting does something a distant clinic simply cannot do. This also means that the vehicle has real requirements. Off-road capability for unpaved roads, satellite internet where cell coverage cannot reach, and the ability to reflect community identity on the exterior. These features are what makes the program usable. A few practical details before you apply. RHTP is reimbursement based. You spend first and then submit documentation for repayment. Funds cover infrastructure, equipment, technology, and planning. They do not replace funding that you're already receiving for the same work. It has to be new or an expansion. Strong applications do one thing well. They explain clearly how a mobile program will reach people who aren't currently being served. Minnesota wants to see that you've thought through staffing, outreach, billing workflows, and how you'll track encounters. The application window closes May 15th, 2026. So don't wait. Minnesota has put real money behind a simple idea. Care should come to patients, not the other way around. The window is open now and it's closing soon. If you're thinking about what a mobile program looks like for your organization, talk to the Avan team. We can help you match the right vehicle to your specific needs. If you have any questions, put them in the comments. We're always here to help.